Hey everyone, it's Dr. Vetere, and I hope you're having a fabulous day. I just want to spend a few minutes explaining some of the things about the office that may be of interest and possibly quite helpful. First of all, the office hours are Monday, Tuesday, and Thursday from 8 a.m. to noon and 3 p.m. to 7 p.m. And as you know, you should be getting text messages to remind you to keep your appointments. If you cannot keep your appointment, please just give me the courtesy of a text message back to my cell phone, which the number is typically on the automated message. And if you don't know my cell, just pick up one of my business cards and you'll see I have my cell number put right there. And just simply send me a text so I know what's going on. Or if you decide to disappear, just send me a text and let me know. If you're not feeling well, like you feel a little run down or the beginning of a cold or a flu, it's imperative to come in and get your adjustment. The adjustment will help you feel better faster, improve your immune response, and make you just get better faster. Believe me, I've been doing this for a long time, for 38 years. This is something I know that works. Also, I want you to know that whatever you're going through, if you have a neck trouble or a back pain, whatever it may be, there's a lot of other things that we take care of. Headaches, migraines, sinus trouble, people with severe allergies, along with the neck pain and the pain that goes down the arm right into the fingers. Those are all things that we can help correct by getting adjusted. Now, of course, people with the back pain and the sciatic pain, which could be terrible, that goes down the leg, just understand that there's a lot of things that we can take care of. And if you have any friends or family who have these conditions, please, I really appreciate you giving them one of my cards or even giving one of my health passes, which I can explain to you later how it works. But know this, that everyone can get an adjustment, no matter how bad or whatever the situation may be. Little children can get adjusted, older people can get adjusted, even babies. Just think of the whole birth process of being born, the trauma of just being pulled out from the mother's womb. I've adjusted all my grandchildren and so many of my patients who have been pregnant and been adjusted through their pregnancy right up to delivery, which means that if you know someone who's pregnant and has some back trouble or sciatic, which is very common during pregnancy, they can get adjusted right up to the delivery date. And it also improves the flexibility of the pelvis, which will make the delivery even easier to occur, okay? Now, understand this, that if you have a subluxated vertebrae, a pinched nerve in the neck or in the back or whatever the situation, that will control other organs and glands. And let me show you. You've probably seen this diagram before when you first came in. And basically it's a diagram that shows the spinal column here, and the nerves obviously run inside the column, and then the nerves come out between the vertebrae. So for example, if the second cervical vertebrae is subluxated or the nerve is pinching upon it, that means if that bone is pressing on that nerve, what you're going to feel when we look on this side here is pain in the neck and also contributory to headaches, especially migraines. But also the second bone in the neck also controls the sinuses, the nasal palate, the blood vessels that go to the brain and to the eyes. If it's the fourth bone that's subluxated, you can also get the neck pain, but primarily affects, again, the sinuses, the submaxillary, the sublingual gland, which is usually the first line of defense in your overall health of the respiratory system. As we go further down, the fifth and sixth nerve here, the sixth nerve will cause some pain in the neck, but also the symptoms that can go down the arm into the hands, and the thyroid gland is primarily innervated by that sixth nerve. So what that means is this: if that vertebrae right there is subluxated, out of place, or pinching atop that nerve, you'll feel those symptoms, but that organ is going to begin to malfunction because it's controlled by that same very nerve. If we go further down, you can see that the fifth nerve in the middle of the back, your thoracic spine, may give you pain across between your shoulder blades, but also affect the function of your stomach. While the eighth nerve, which is in the eighth thoracic in the mid to lower back, gives a lower pain profile, like below the ribs to the waist, but affects the function of the liver. And it goes on and on, okay? The 10th nerve innervates the small intestines. The 11th and 12th nerve innervates the kidneys. So if that bone, again, is out of place, subluxated, or the disc is out of place, pressing on the nerve, you'll get this back pain, but it also affects the function of the kidneys. When you go further down, the 2nd lumbar nerve will give you pain in the lower back, probably into the hips, in front of the thighs, but also affect the function of the large intestines. As we go further down, like the 4th and 5th nerve, that'll go all the way down the leg to the feet, but this will begin to affect the intestines, the colon, the rectum, the reproductive organs, the bladder. It's a whole lot of health problems that can occur once that vertebrae becomes subluxated, causing nerve interference, okay? If you have any questions about that, ask me, because when you're worrying about the pain going away, I'm more concerned about how and what organs and glands are being affected by that nerve irritation. Finally, I want you to know that I'm interested in your overall health. For example, I'm giving out these vitamin questionnaires, and in that, I can help you figure out what vitamins will be necessary to help you improve your overall health. I take a whole pile of vitamins. I've been doing it for a long time. I'm going to be 63. I don't take medicines. I just take natural stuff to help me get well. Also, I want you to know that coming in the near future, we have a wellness site that you can go on and learn all about what to do in order to get well naturally and to stay well. Also, I'm always here to answer your questions. If you have a question or a problem, please text me, call me, speak to me. I want to be here to help you. And finally, the best compliment I can ever get. I mean, I love the 5-star reviews, but when you refer somebody, a friend or a family, entrusting their health into me, that's nothing. That is the biggest compliment I can get. I can't tell you how much I appreciate it. And we have special offers. If you use a health pass or the referral card, there's a QR code to give them a special offer. Please take advantage of those things to help everyone around you get well and to be healthy. God bless. See you for your next appointment. Talk to you soon.